Today we're going to be talking about keto diet versus the low-fat, whole food, plant-based diet for diabetes reversal. So today I want to break down the benefits as well as the drawbacks of two very popular diets when it comes to weight loss and diabetes. That is the keto diet, known as the low-carb diet, that consists of a minimum of 5% and most to 10% of your calories coming from carbohydrates and the rest coming from protein and fat. And we'll look at that and compare it to a low-fat, whole food, plant-based diet, which is quite different in that it includes complex carbs and no limitation. So how I'll do this video, and I'll try to keep it short, is I'm going to start out with the keto diet, and we're gonna basically, that's gonna be part one. So part one is gonna be the keto diet and its benefits as well as its drawbacks. Part two will be the low-fat diet, the low-fat whole food plant-based diet, and we'll examine its benefits versus drawbacks. Let's go. So the keto diet has many benefits, okay? And so the biggest benefit for many people is that draws people to the diet is the weight loss. And on a keto diet, you will experience weight loss. Some people experience quite a bit of weight loss. In my time practicing as a physician assistant, I've seen people on keto diets lose a significant amount of weight. It can be actually more effective than even medications for weight loss, and not to mention other diets that are meant for weight loss. So benefit number one is weight loss. Benefit number two, you can actually find that your blood sugars improve as a diabetic very quickly when you're on a keto diet. My wife has experienced this. Many of my patients and clients have experienced this as well. Benefit number three, tied to benefit number two, is a improvement in your A1C. What we're all looking for, that golden number to see the A1C come down. And you can see your A1C come down quite fast on a keto diet. And of course, this leads to benefit number four, which we're all looking for, right? A reduction in diabetes medications. That includes injections and oral medications. When you're on a keto diet, you need less diabetes medicine. So benefit number five, I would like to throw in, because many people love their meat. So if you're into sausage and bacon and ham, you could eat it without limit on a keto diet, right? So to quote a classic movie, meat is back on the menu when it comes to keto diets, right? So that definitely is a draw for many. So what are the drawbacks of a keto diet? So drawback number one is that a keto diet, according to many studies that examine the effect of a high protein, high fat diet, because that's what a keto diet is, a keto diet can increase your risk for chronic disease and premature death. That's a pretty big drawback. So, we're talking about, of course, chronic diseases like heart disease, stroke, heart attacks, early onset with dementia, cancers. Many studies, and I'll actually link some of those studies in the description section, show that a diet that is high in animal protein as well as fat can increase your risk of premature death and development of chronic disease. So big drawback. Drawback number two for a keto diet is that a keto diet can actually be very difficult to stick with, because of course, naturally, when you look at how much food is out there in a produce section or in a grocery store, the vast majority is carbohydrate, right? Just go outside in a garden or just go walk outside, and you'll see that the vast majority of food sources come from carbohydrates. So you're really limited, and sticking with a keto diet can be very difficult to maintain long term, because it eliminates so much of the food that is available to you. Drawback number 3 also is tied to health, and that is that you are starving your gut microbiome. There's a lot of talk these days about gut health, and a keto diet unfortunately starves your gut. Your gut, which is the lining of your intestines, it actually feeds off of fiber. So in a keto diet, there's virtually no fiber. Thus, you are starving your gut microbiome, and this could lead to, of course, detrimental effects in the long term when it comes to gut health. Now, I actually forgot one other benefit of the keto diet, which is kind of interesting in that it kind of seems to contradict the drawbacks of the keto diet. When you're on a keto diet, many people experience an improvement in their biomarkers. Those are things like your blood pressure, your cholesterol levels. You'll see that those lab results actually improve while on a keto diet. But the problem is many long-term studies when it comes to diets that are high in protein and fat show that long-term, actually the bad outweighs the good when it comes to your long-term health. One other thing that is a drawback to the keto diet, and that is the stress it puts on your kidneys. Studies show that a diet that is high in animal protein is toxic to your kidneys in the long term. So those are the drawbacks of the keto diet. And let's move on to the benefits of a low-fat, whole food, plant-based diet. Starting off the top, the benefit of a low-fat, whole food, plant-based diet is that you will lose weight, and you can lose weight fast. Again, better than many of those weight loss medications out there, better than many other diets for weight loss. Low-fat, whole food, plant-based diet can lead, when done right, to weight loss. Benefit number 2, you also see an improvement in your blood sugar levels. So your blood glucose levels can normalize very quickly on a low-fat, whole food, plant-based diet. Benefit number 3, you also see a reduction in your weight loss, in your A1C pretty fast. That golden number starts to come down to safe levels when you're on a low-fat, whole food, plant-based diet. And of course, the benefit of reducing your need of medication is key, because as your blood sugar levels improve, your A1C improves, you need less medicine when you're on a low-fat, whole food, plant-based diet. And of course, the benefit that I think outweighs them all is that when you're on a low-fat, whole food, plant-based diet, you are improving your chance to live longer and healthier. So many studies show that longevity and your chances of avoiding chronic diseases like heart attacks, strokes, early onset of dementia, these things tend to happen at a much later age when compared to the general population. Of course, you got to die of something. So sorry, it is not the cure for death, but it can stave off a lot of the things that are killing us in this generation, who are eating a standard diet, especially when compared to a keto diet. You're going to avoid a lot of the chronic diseases, including, like I mentioned before, heart attack, stroke, many types of cancer are prevented and held back through a low-fat, whole food, plant-based diet. So what is the drawback of a low-fat, whole food, plant-based diet? I could think of only one. So the drawback of a low-fat, whole food, plant-based diet is that it can be difficult to comply with, because if you think about how many of us are used to eating, a diet that's high in fat, salt, sugar, savory, fried foods, a lot of us have food addictions, food cravings, and to change the way you're eating to a low-fat, wholesome, that means minimally processed, getting rid of the processed sugar in your diet can be very hard and difficult. But that's the only drawback. It's hard, it's difficult when you're transitioning from a standard diet or a keto diet, even more so, to a low-fat, whole food, plant-based diet. That is the only drawback. There are no other drawbacks to a low-fat, whole food, plant-based diet. When it comes to your long-term health, there are only benefits. That being said, so many people that's where many people start to think They need people like me. They need a health coach. They need somebody who isn't just going to see them once a year or 3 times a year when you're sitting in a doctor's office. They need the help of a coach, someone that can help them overcome those food addictions and those food cravings. And this is an opportunity that I present to you if you're watching this video. In the link or description section, in the description section, there's a link for you to join my free Facebook group. In this group, every day I post information, instruction, motivation to keep you on track in your health journey. Whether your goal is weight loss or your goal is to improve your diabetes health, this group is for you and it's free to join. So that's number one. Number two, another thing that's going to be very beneficial for anyone watching this video is an opportunity to get access to over 250 low-fat, whole food, plant-based recipes. That's right, over 250. So if you think that, man, what am I going to eat? No problem, I got you. So in the description section, there's also a link that will get you access to over 250 recipes at your disposal. Okay, it also includes an instructional video that goes deeper into diabetes reversal and weight loss. So have at it, enjoy it, and I hope to see you next time on my videos that I'll be posting weekly. If you have any other questions, comments, concerns, please leave them in the comment section below. And as always, this is Diabetes 180, and my name is Bertus, your diabetes reversal health coach.